Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know very well that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 9226810 My dear friends, today we are going to discuss about clinical examination of motor system, part 1. My dear friend, nervous system examination is a very important topic for all the types of medical students and medical doctors. Maybe allopathy branch, maybe Ayurveda, maybe homeopathy, maybe physiotherapy. Everywhere the examination part is very important. Already, I have on my channel, Ayurveda Academy YouTube channel, you can see the playlist clinical examination, and there you will get a proper demonstration of each and everything. But here we are going to focus on mainly what you can say the textual or theoretical aspect of this particular discussion. So clinical examination of motor system, it includes a lot of factors. For example, we have to check the nutrition of the muscle, then tone of the muscle, power of the muscle, and coordination in the different muscle groups. So first we will try to see this particular part, what for we are doing this nervous system examination, which type of the patient they come to us, and then we think of, oh, nervous system is very important. For example, the patient may complain partial or total inactivity of the body part. For example, I cannot move my hand, the patient cannot move his leg, etc. Sometimes there may be a symptom like painful movements. Then some patients will come, doctor, this particular right thigh is looking to be small. That is reduction in the size of muscles. Then some patient may say, doctor, I am having this type of the tremor, involuntary abnormal movements that can be the complaint of the patient. Then there may be difficulty in working, difficulty in standing, difficulty in walking. So these are all types of the complaints by the patient. Next, what we require to do the examination of this nutrition, especially, we will require the measuring tape. Suppose we want to check the reflexes, then we will need the clinical hammer. Do not say only hammer, it's a clinical hammer. Then let us start to discuss which type of the different examinations we are going to learn in this part 1 and also in the part 2. For example, size, tone, power and coordination only we will discuss in part 1. And in the part 2, we will go for these abnormal movements, posture, gait and reflexes. I think the point is very clear. In the first part, you will get the knowledge of these first 4 points, and in the second part, you will get the knowledge of remaining 4 points of motor system examination. So before going further, let me tell you, first we will check the nutrition of muscles, that is the size of the muscle. Then we will also see the tone of the muscle, then power or the strength of muscle, then the coordination in the different muscle groups. In the second part, we are going to see the abnormal movements, posture, gait, and reflexes. Let us start to learn step by step. First part is nutrition of muscles. Can you see here? Always point out my cursor. It is judged by noting the circumference of the extremities. That means hands and legs at the level where you can see maximum muscle tissue is present. By convention, by tradition, these levels are, for example, we want to check the arm muscles. In the arm, we should keep the measuring tape 5 inches above the level of elbow joint. This is my elbow, 5 inches above the elbow joint. Then in the forearm, 4 inches below the level of elbow point. This is my elbow joint, and below that 4 inches I have to check the circumference. In the thigh, 9 inches above the level of knee joint, and in the leg, 6 inches below the level of the knee joint. Okay. Observe, doctor should observe, is there any difference between the girth of right side and left side of the hands as well as the legs? Hands and legs are called as the upper extremities hands and lower extremities legs. Here you can see in my video, actually, when you will see the detailed video, you will see all these demonstrations. This is my teacher, Dr. A.R. Joshi sir, and he is showing how you are examining here the girth of that particular muscle. So he has measured by measuring tape, for example, 6 inches below the level of knee joint. Here that you are seeing 6 inches from the knee joint. Okay. Next examination is tone of the muscle. What is the tone of the muscle? This is the common question in the Viva, in the oral. So tone of the muscle is a state of partial contraction of the resting muscle. Partial state of contraction. And it is tested, it is examined by the feel of the muscle and by resistance to the passive movements. So first definition, tone of the muscle, state of partial contraction. How it is tested? Number one, feel, that is a palpation. This is also the movement, palpation, resistance to the passive movements. The subject means volunteer or the patient should be instructed to relax his extremities before testing the tone of the muscle. Now, first, feel the muscle by grasping it between the thumb and fingers. Normal feel of any muscle should be firm, elastic, and the muscle can be moved from side to side to a great extent. See, doctor should see whether the tone is increased. That means the muscle is more hard and rigid to feel, or there may be muscle tone decreased. So muscle will be soft and flabby to feel. Okay, see, can you see here? Dr. A.R. Joshi sir is examining the tone of the muscle. This is the method of tone of the muscle. Feel. You have to check the feel. Now, tone of the muscle, another method. Holding the limb, either hands or leg, and carry out, the doctor should make the passive movements at various joints and note the resistance offered. In normal, healthy individual, everybody, you and me, small amount of force is required to carry out passive movements. A little, small amount of force. In hypertonia, resistance offered by the muscle is increased. In hypotonia, resistance offered is decreased. Now, you can see here these passive movements, folding the leg in the knee joint and then making it again stretch. So this is also one of the examination method for examining the tone of the muscle. Now we are going further. We want to check the power or the strength of the muscle. Muscle power is tested by noting active movements at each joint, first without resistance and then against the resistance. If it is decreased, then the doctor should note the grade of the power of the muscle. And where that grade is low, whether that grade is normal, that distribution should be noted. Now, we are testing the power of the muscles. So there are different grades. In the examination, they will be always asked, and the student is asked to examine the volunteer and show what is the normal grade. Actually, in the normal person, the grade will always be 5. But if the patient is paralysis, hemiplegia, quadriplegia, then these grades, in the beginning, it will be 0. And after some few weeks, few months, the grade will gradually improve. the nervous system, what you can say, the improvement is always possible till the maximum of 6 months. So there you will require the Ayurvedic treatment, modern treatment, and also physiotherapy is very important to come back to the normal after hemiplegia attack. Now grade 0, for example, when there is a stroke, cerebrovascular accident in the brain, there may be hemorrhage, subarachnoid hemorrhage, there may be thrombosis, there may be embolism, and the person gets hemiplegia. Space occupying lesion will be there, tumor may be there, thrombosis may be there. That is called as a space occupying lesion here in the brain. Okay, so when the patient is first admitted on the first moment, actually I will request all of you, whenever you find any of your relative, any of your friend, any of the person in the society having the weakness of the hands and legs, immediately take him to the hospital, because after the stroke, after the heart attack, after the kidney failure, anything after the bleeding in the woman, first 4 hours, first 3 4 hours are very important for the quality life of the patient. First 3 4 hours after any basic symptom arises, these hours are called as a golden hours. So don't waste the time. According to your budget, according to your economical status, find out the governmental or semi-governmental or the private hospital where ICU facility should be there, ventilator, oxygen, antithrombolytic treatment, and then you admit the patient. So what is my recommendation? Each and every family should have in their house the important telephone numbers of the ambulance, not only 1, 2 or 3 ambulance, important phone numbers of the nearby best hospitals with ICU or CCU facility. So I hope this power of muscle, this is okay, examination. But this another sector, another knowledge concerned to that point is very important, which is very practical. So grade 0 is a no movement at all in the hands, in the legs, in the fingers, nowhere. Grade 1, flickering of muscles if movement attempted, only flickering. Grade 2, movement of the joint eliminating gravity. That is nothing but side to side movement of the hands or legs on the lying down bed. Where the patient is lying down, he will just move on right or left side of his hand or leg. He cannot lift the hand, because lifting the hand is against the gravity. But we are seeing eliminating gravity. So side to side movement. Grade 3, movement of the joint against the gravity. So he will slowly lift his hand from the bed. This is a bed, he will lift the hand. Then grade 4, movement of the joint against gravity with moderate resistance. Doctor will keep his hand and then he will ask, okay, lift your hand, lift your try, okay. So this is moderate type of resistance. Grade 5, normal person, movement of the joint against the gravity with strong resistance. For example, the patient has lying down and then doctor is asking, okay, lift your hand, and doctor will press his hand strongly. Okay, so this is all about the power of the muscles, grade 0, 1, 2, 3, 4, and 5. Here you can see the little bit testing of the power of the muscle by my guru, my teacher, Dr. A.R. Joshi sir. The patient is asked to lift. So this is against the gravity. This is against the gravity. Okay. Next examination part in the motor system is coordination of movement. What is coordination? Harmonious activity and correct sequence of action of appropriate muscles inherent in a normal movement. This is coordination. It depends upon the integrity of sensory path in the posterior columns, cerebellum, and motor tracts. Integrity means well functioning of all these systems together. So what are the tests of coordination? In superior extremities, that means upper part of your body, hands. Here is a finger nose test. The subject is asked to touch the tip of the nose and the tip of the index finger of the outstretched arm. These all demonstrations are available on my live videos available in the playlist clinical examination. Then this particular patient or the volunteer must be able to do it both slowly and rapid. This is a slow, just small demonstration, and this is fast. But patient's eyes should be closed. Patient's eyes should be closed. He is then asked first with the open eyes and then with the closed eyes. The patient will be asked to perform the same action with the eyes closed. Finger nose test is a test of coordination in superior extremity. Can you see here? Volunteer is there, and then he is touching the nose of the tip of the finger here, tip of the nose, and with the finger, and then this is index finger. This particular movement is called as a test of coordination. Next is a finger to finger test. The subject, that means the patient, is asked to outstretch both the hands and touch the tip of the both index finger in the center slowly and rapidly with the eyes open and with the eyes closed. So this is finger to finger test. Next test of coordination is didacokinesis. Didacokinesis. This is the ability to execute alternating movement such as the pronation and supination of forearm rapidly. Ability to execute alternating movements such as pronation and supination of forearm rapidly. Can you see the patient is performing didacokinesis test? Now, test for coordination in the inferior extremity. The first test is called as walking along a straight line. The name is tandem gait. Tandem gait. Tandem gait. Tandem gait. First with the eyes open and then with the eyes closed. The subject is asked to walk in this way. Now, I am sorry, this is a printing mistake. The next test of coordination in inferior extremities is heel to knee test. What is that? Heel to knee test. In this particular test, what is happening? The patient will be asked to touch the heel to the knee joint on the opposite side and to slide it along the shin up to the ankle joint. I repeat, heel to knee test. Touch the heel to the knee joint on the opposite side and to slide it along the shin up to the ankle joint. Can you see here? The test has been picturized in this particular slide. So you can see, and all these live videos are available on clinical examination of my channel. Next test of coordination is Romberg's sign. Romberg's sign. It is regarded as the special test for coordination of lower limbs. The subject is asked to stand erect with the heels close together, first with the eyes open and then eyes closed. If the patient sways on closing the eyes, Romberg's sign is a positive test and is seen in the sensory ataxia, loss of balance. In motor ataxia, which is also called as a cerebellar ataxia, the patient sways irrespective of whether his eyes are open or closed. When his eyes open, still he loses the balance. When the eyes are closed, also patient is losing the balance. He cannot stand straight. That is also called as a Romberg sign positive in the motor ataxia. Next, how to fill your case paper. Nutrition of the muscle, for example, these are the observations: name of the patient, name of the volunteer, age and the gender. In the upper extremities, you have to measure the circumference by measuring tape. It may be mentioned as a centimeter or in inches. For example, in upper extremities, 5th inches above the elbow joint, you measure in tape, and girth should be measured over here. Then in upper extremities, 4 inches below the elbow joint, measure the girth. Then lower extremities, 9 inches above knee joint and 6 inches below the knee joint. Right and left side, you have to compare. Now this is the, what you can say, the pointing or writing of tone of the muscle. For example, always right side and left side should be compared. In the upper extremity, degree of resistance, range of movement, and feel of the muscle. Normal feel is a firm and elastic. The similar way in the lower extremities, that is the legs, degree of resistance, range of movement, and feel of the muscle. This is the way how you can test the tone of the muscle. Then muscle power, for example, these are the different muscle groups, and here grade of muscle power, right side and left side. Of course, this is a healthy volunteer, so grade 5 is present everywhere. Neck flexors and extensors. In the shoulder girdle, there may be flexion, extension, adduction, and abduction. Upper arm muscles, flexion and extension of elbow mainly. Forearm muscle, flexion, extension of the wrist, pronation, supination of the forearm. Now the finger movements, flexion, extension, adduction, and abduction. Abdominal muscles tested by head raising and leg raising in supine position. Now hip girdle, flexion, extension, abduction, adduction, medial and lateral rotation. So these are the movements according to the different muscle groups. In the thigh muscles, extension and flexion of knee. In the leg muscles, dorsiflexion, plantar flexion, eversion and inversion of the foot. So these all healthy volunteers, the grades are 5. Now coordination test, again right side and left side. Upper extremities, you can perform the finger nose test, finger to finger test, and diadacokinesia. Right side, eyes open and eyes closed. Left side, eyes open and eyes closed. Now in the lower extremities, heel knee test, Romberg's sign, and tandem gait. Tandem gait is a walking in straight line. Now, what can be the questions asked during the examination in this particular practical motor system examination? So he will ask examiner, what is meant by atrophy and hypertrophy of the muscles? What are the conditions in which atrophy is observed or hypertrophy is observed? So the student should answer, atrophy means decrease in size of the muscle due to decrease in size of muscle fibers. This atrophy is observed in cases of paralysis, especially lower motor neuron, poliomyelitis and peripheral neuritis. This atrophy is also seen when the muscles cannot be used for a longer time. For example, due to the limb immobilized in plaster. This is an example of disuse atrophy. Now next answer will be about hypertrophy. Hypertrophy means increase in the size of the muscles due to increase in the size of muscle fibers. This hypertrophy is observed when a particular muscle is exercised for a long time. Next question in the examination, define paresis, paralysis, monoplegia, hemiplegia, quadriplegia, paraplegia, UMN, LMN. The student will answer one by one. He should remember all these definitions. Paresis. What is paresis? There is a difference in paresis and paralysis. Paresis is a feeble power and here loss of power. So here weakness starts and here total loss of action. So paresis, is a feeble power of contraction of a muscle group due to the weakness of muscle. Paralysis, loss of power of a muscle group resulting in absence of contraction of those muscles. What is monoplegia? Paralysis of one arm or one leg. What is hemiplegia? Paralysis of one side of the body. What is quadriplegia? Paralysis of both arms and both legs. Paraplegia is paralysis of both the lower limb. Here, hands and legs both. Quadri means four. Para means only lower limbs. What is UMN? Upper motor neuron. This is the nerve fiber extends from the higher center to the cranial nerve nuclei in brainstem, or from higher center to the lower motor neuron in the spinal cord. What is lower motor neuron? LMN. This nerve extends from cranial nerve nuclei or anterior motor neuron in spinal cord to the effector organ. Next, question number 3, the examiner will ask to the student, state the necessity of examining active movements first without resistance and then against the resistance. So the student should answer, active movements are examined first without resistance and then against the resistance to judge the grade of power or strength of the muscle. Next question by the examiner, what is ataxia? What are the types of ataxia? State and explain one clinical test which is used to distinguish the types of ataxia. Ataxia is a lack of coordination of body movements. Types of ataxia, sensory ataxia and motor ataxia. Now there is one test, Romberg's test, standing in a straight position. Romberg's test is a clinical test which is used to distinguish between the two types of ataxia. The reason for this is that Romberg's test, cerebellar or motor ataxia patients are not stable, whether they open or whether they close the eyes. Both the times they will lose the balance. While in sensory ataxia, the patients and normal volunteers remained stable during the eye opening. Only when they will close the eye, they will fall down. But opening eye, okay. That is called as a sensory ataxia. So my dear friend, this is all about motor system examination. If anybody of you have any health and physical or psychological problems, you can take the paid online consultation from the expert doctors of Ayurveda Academy. The WhatsApp number is 9226810630. My dear friends, a disclaimer I want to tell you, you have to take the necessary guidance from the physician or the qualified health provider if any difficulty arises in your life regarding your health. My dear friends, one important good news for you. All these of my videos nowadays are having the subtitle and even the audio dubbing in the different Indian languages and also foreign languages. Marathi, Hindi, English, Gujarati, Odisha, German, Spanish, and Italian. All these languages are available for my videos because of the grace of YouTube management. And there you can see the subtitles as well as the dubbing in the different languages. So there is no worry whether my video is in Hindi, Marathi, or English. Everything, everywhere is available right now. So I wish you all the best. Thank you very much. And we will see the motor system examination part 2 in the next video. Thank you very much and take care.